Well, yeah, my name is Dr. Clifford Porter. I'm in support of course House Bill 3015. So I'm the senior fellow for healthcare at the Texas Public Policy Foundation, whom I represent. I'm also representing myself. I'm a practicing physician locally using the direct primary care model, actually, called Texas Direct Medical Care. So this is an excellent bill. It allows me to do a great deal for my patients and so forth. So it's immediate, better health care, and it actually reduces costs, out-of-pocket costs for teachers and employees. So it's a de facto raise. So it reduces barriers to health care and actually also reduces state costs. And some of the handouts there, I can actually explain a little more detail for it. So it's membership-based clinics, and I just do it by monthly. So, for example, my clinic, and they're roughly about the same, charge $90 a month, $90 to $120 a month, and half price for spouse and kids. So if they're on the ERS, TRS plan, then they're all included in that. So there's no co-pays, there's no deductibles or anything else like that. And so it really reduces costs a great deal. I'm not billing for insurance, and I'll explain that in a minute, why that becomes so more important. So I actually have 2 state employees already who are members of my practice, one from the Railway Commission, and they just like the better medicine because that's currently available in a lot of these corporate-run clinics, which I often call treadmill medicine. So by crediting DPC and having that advantage, people can get same-day appointments. I tell people explicitly I do primary and urgent care because people don't think they can go to the primary care to get urgent care. Think they have to wait 2, 3, 4, 5 weeks and so forth. So insurance-driven clinics, for example, you come in, you pay your copay, they ask you all kinds of questions. It's all about billing. It's all about charting for billing. And so that's where we get, all of it has that experience where they ask a bunch of dumb questions, and it's all about charting. And then to bill insurance, and they have to go faster and faster in order to meet those requirements. By doing the membership, all that stops. The money essentially is off the table. So when someone comes in, I can spend 30, 60 minutes, and some people I'll spend 90 minutes, the initial review. So an example I had a couple years ago, a patient had heart palpitations, heart racing. A regular clinic, okay, they take your copay, that's the heart, referral to cardiology, and then move on to the next patient. So we don't do that. We actually do the EKG, we do the labs, we figure out what was going on, going through all our supplements, and found out this patient, mid-30s, EKG normal, labs normal, caffeine sensitivity. And so we just cut everything on that, got her to decaf, heart palpitations went away. So no extra costs, no referrals, everything handled for it. So we also, by being this flexible, I have people actually will call, text, email for simple referrals, and that actually makes it so much easier. So you avoid a visit, avoid copays. So on the handout, there's a couple there. One's the discussion of it. On the back side, there's actually, in the green dots is all the direct primary care clinics in Texas. And so it's grown tremendously, actually.